Hello, this is Dusty Metcalf with San Juan College. I'm going to show you task 19 today, the surgery and anesthesia videos, which are filling out appropriate records, gathering appropriate records for surgery patients. So this is our surgery form. It has a lot of really helpful information on this sheet. So we have the patient's name, client and patient number. We have the weight of the patient in both pounds and kilograms. We have the ASA status of the patient, date of birth, species. We have a presenting TPR or vitals that we're always going to write down to make sure we know of any changes that are happening. This patient has an 18-gauge catheter in its right cephalic vein. We have surgery, anesthesia, start time, procedure, start and end time, and then anesthesia end time and extubation time. These are all things we're going to keep track of. And then we get to all the drugs on the anesthesia sheet. So first it's going to tell us what IV fluids we're using, what our maintenance rate is, what our anesthetic maintenance rate is. We have both a rate and a volume. It tells us we're going to be using LRS. Then we have all of the medications that we're going to be using before, during, and after surgery here that are highlighted. So intraoperatively, this patient got cefazolin, and we have the concentration, the dosage, the calculated dose for that patient, the actual volume, what route it was given, what time it was given, and then also the technician that gave its initials. And this patient's also going to get hydromorphone. Again, everything is listed for each drug. So each drug has concentration, dosage, the calculated dose, the volume of that drug, what route we're going to be giving that drug. Then we always will mark the time and our initials. This patient's also getting propofol for induction. And then post-op, she's going to get hydro and a fentanyl patch. This patient also was a mast cell tumor removal, which is noted at the top here. So we did give Dex-SP and diphenhydramine in case of any reactions. And then the back of our sheet is our anesthesia log flow chart. So these vitals we're going to be checking at least every 5 minutes, and we are going to write them on this chart with the time. We're going to note the heart rate, the pulse, the resp rate, the temperature, mucous membranes and CRT, O2 saturations, blood pressure, systolic and diastolic. We're also going to want the mean blood pressure, the percent of gas anesthetic we're using, the oxygen flow rate, the EtCO2 measurement that the machine's giving us, and then the last section is for comments. If we gave drugs, like this patient needed atropine, its heart rate was a little bit low, we wanted to bring that up. We also turned down the ISO here to assist with that heart rate. And then we'll just make any little notes. So this patient had a couple different masses. Halfway through the procedure, we flipped her to her right side. And that's really going to help us and the surgeon write the report later. And it's also going to help us log drugs later. So all of our controlled medications, which were the hydro and the fentanyl, we are going to want to make sure get recorded. So this is an example of our log book, hydromorphone. So we always have a patient and client sticker label. The book is always going to say the drug name at the top, the drug strength, what form this drug is in, and then whatever number we assign to this controlled drug so that we can log it and stay legal. We always start out with the balance of whatever is in that particular drug bottle, and then we write down how much we dispensed and how much we administered. The person who dispensed the drug is going to be the signature of dispenser, and then we always need somebody to witness that drug was dispensed to that patient. The other thing that I do just want to cover On our drug sheet, even though we don't have anything highlighted here, we have emergency drugs listed just in case something happens. So for this patient, again, we did give atropine and glycopyrrate to help with the heart rate, and you can see the times that those were given. So we always do have that available for us in case anything goes wrong. It's super quick, easy access. It's very nice to have. And we basically just type in the weight into the computer, and the computer does all this math and calculations really fast and accurately for us. Once we are done with our surgery sheet, we place it in the patient's medical record. We always place these on the right side. This is our procedure area in case we ever need to come back to this again. We're going to go ahead and return our drug logbook to the area we keep these. And then surgery records we don't upload into the computer, but say if there was blood work or something, we'd upload that in the computer. But as far as finishing the record, this is all we have to do for that. The doctor will type a written report that will go in later, but again, that's for the doctor to do. So that's pretty much the end.